Good afternoon, ladies and gentlemen. Thank you for your patience and for tuning in today. The purpose of today's press briefing is to provide the community with the most current information on the status of COVID-19, on our hospital capacity, and on some potential impacts that the governor's executive orders may have on our local businesses in the weeks ahead. We're in the 9th month of working to address COVID-19, and in that time, people's lives and livelihoods have been adversely impacted, whether by the virus itself or by the steps taken to slow the virus. And I know everyone is tired of hearing about it. COVID fatigue is real, and COVID cynicism is also widespread. And in many cases, that cynicism is well-founded. Whether changing opinions from the CDC, headlines we've all seen about heavy-handed officials saying one thing and then doing another, or the example last week about an elected official encouraging people to stay home while he himself was on an exotic vacation. Heavy-handedness is counterproductive and unnecessary. In Victoria County, we've consistently taken the opposite approach. Rather than mandates and edicts, we've worked to provide information and guidance. Since the beginning, one of our main focuses and priorities has been to ensure that we maintain capacity in our hospitals that is sufficient to meet the community's health care needs. Our residents have an expectation that if they get sick, there will be a hospital bed immediately available for them. And if they get really sick, there will be an ICU bed readily available. And it's a top priority also because hospital capacity is one of the most reliable barometers we have as to the severity of COVID in the community. We know that cases are increasing here, just like when they were increasing over the summer. As those cases increase and those folks end up in the hospital, the available beds decreases. Governor Abbott's executive order GA32 uses hospital capacity as a metric to determine occupancy level for our businesses. His current order says that when COVID patients exceed 15% of hospital capacity for a 7-day period of time, then businesses in that region that can operate at 75% have to drop to 50%. And that bars in the region have to close. In Victoria County, meeting that threshold would mean that the bars we were able to open a couple months ago would have to close, and again, that capacity at most businesses would decrease. About a week ago, we went 4 days into that 7-day threshold of exceeding the 15% capacity. Fortunately, it has dropped below that level, so the clock starts over, but we've been hovering right below 15% for about a week now. And that's something that we will need to keep a close eye on in order to provide the community with where we stand at that metric. We're going to add that number, that percentage, to the information that we put out on a daily basis so that the community and our business owners are aware of where we stand, and we can see that threshold approaching if we are in fact going to hit it. I have no doubt that our community will get through this surge like we did in the summer, but I think it's also important to bear in mind that the burden of this is not carried equally. Our frontline medical personnel, our doctors and our nurses, bear the brunt of the COVID-19 impact, along with businesses that have to reduce capacity or shut down for the sake of the rest of us. While the governor's executive order prohibits any local decision-making to supersede it or run counter to it, it is something that we need to watch because it will have an impact on our community if we do go that 7 days exceeding the threshold. Mayor Rawley McCoy will address us now, followed by Dr. McNeill and David Gonzales, who will speak more in depth to the numbers that we're experiencing. Mayor?
Thank you, Judge. Good afternoon, Victoria. As the judge said once again, we're seeing an increase in our numbers, and it is within our power to slow the spread of COVID, keep our communities safe, and keep our businesses open. We all have a part to play, and by this point, we all know what to do. As the judge has said, the governor's order says bars must close and certain businesses have to reduce capacity to 50% if our COVID-19 cases to hospital capacity rate exceeds 15% for 7 days. While this isn't a number or determination we have made or anything we have control over, we will be adding information to our daily case counts release that the health department does to keep you all informed of where we currently sit. This will allow businesses to know how close we are to hitting the governor's threshold and when they will need to prepare to modify their business operations. If we do hit the governor's threshold, our Office of Emergency Management, in conjunction with the city and the county fire marshals and members of our business task force, will run an educational campaign to keep our businesses aware of the requirements of the governor's orders. If we do enter into this phase of our hospital capacity, before bars can reopen and certain businesses can return to 75% occupancy, our COVID to hospital capacity rate will have to drop back below the 15% for 7 days in a row. Now notice I keep saying if, because this is all within your hands and within your power to control. We can keep our community safe by doing what we all know will work. Wear a mask, socially distance, and wash your hands. Especially as we go into a holiday season with family and friends, please make sure that you are doing everything you can to protect yourself and your loved ones. With that, I turn the mic over to David Gonzales, the Director of the Victoria County Public Health Department. David?
Thank you, Judge. Thank you, Mayor. As a reminder, Victoria County remains in a minimal to moderate community transmission level, which indicates a sustained transmission with high likelihood of exposure within communal settings and potential for rapid increase in cases. As of today, our 7-day moving average of new cases currently sits at an average of 25 new cases per day over the past 7 days, and if you recall, it's comparable to what it was 2 weeks ago at the last press conference. With that said, however, we do expect an increase moving ahead in the coming weeks and months as we see the effects of the holiday weekends. As the Judge and Mayor mentioned, the 7-day measurable of patients hospitalized with COVID as compared to the regional hospital capacity in our region is an important metric that we monitor daily. Currently, as of yesterday, that number sits at 14.6% and has remained below the threshold for the past 6 days. However, it continues to remain very close to the 15% threshold. Moving on to a vaccine update. The governor recently announced that Texas will be receiving 1.4 million doses of COVID-19 vaccine in the month of December, with approximately 224,000 doses of the Pfizer vaccine shipped to 109 hospitals across the state as early as next week. This will be just the first of many weeks of vaccine shipments that is expected to be the most limited distribution moving forward. Since protecting healthcare workers is essential to keeping the healthcare system intact and able to care for COVID-19 and other patients, Phase 1A of the vaccine distribution will primarily focus on making vaccine available to healthcare workers as well as residents to long-term care facilities. Last week, the CDC updated their guidance to the quarantine guidelines, which now reduces the quarantine period down to 10 days after the last contact of a positive COVID patient without a negative test, or down to 7 days with a negative COVID test. Keep in mind, these quarantine guidelines only apply to those close contacts to COVID-19 positive cases. These new guidelines do not apply to positive cases. Those isolation guidelines will remain the same as current. Finally, as the judge and the mayor mentioned before, we'll be rolling out a new graphical format, reporting format on our Facebook page. Will look a little different, but we'll have all the same information as we've been reporting on before, as well as include that hospital capacity metric that we discussed earlier. Please continue to look to our Facebook page for the most up-to-date information, and we'll do everything we can to keep you informed moving forward. I'll now turn it over to Dr. McNeill.
Thank you, David. I'm going to go through just a few things. I just have a few points. I usually don't have things written down, but there are just a few things that I want to go over, and our very qualified information staff has given me a list of the most common asked questions that people really want to know. So I'll address some of those, and then we'll take questions, of course, and anything I can answer, I will. If not, the smarter people behind me can take care of that. The first thing that I want to say to everybody is that, we're in a point right now to where things are really starting to pick up as far as COVID goes. We always talk to you all about this post-holiday spike in cases, and Thanksgiving is starting to be the same way. Remember, we always look at hospitalizations as a very important metric or parameter that we judge the way things are in our community upon. So I can tell you that I've spoken to the critical care physicians that take care of these patients on a daily basis in the ICU, and I've also spoken to the hospitalists and to the hospitals themselves. And basically, our numbers are increasing. Hospitalizations are increasing. And, we're a couple of weeks out of Thanksgiving right now, and that's exactly when this pretty much predictable course of this disease starts to show itself at the doors of the hospital. So we have more patients coming into the hospital, and that unfortunately is going to mean more people end up in the intensive care unit. Currently, or as of last night, we had about 12 patients between the two hospitals. They're on mechanical ventilation. This means that they are critically ill. They're not able to breathe for themselves. They're not able to sustain their vital signs without extra help. So these are patients that are critically ill, and we have at least 12 of them. We've had multiple admissions in the last 24 hours, so the numbers are increasing. So please remember that. I can tell you that the number of cases is increasing. And another thing that I can tell you is that it seems that a lot of people now are not really being tested. I see patients all the time where one family member is tested positive, the rest of the family gets sick, but they know what they've got because the symptoms are pretty easy to understand. So they don't get tested. So remember that if the numbers go down, that doesn't mean that there's not a lot of disease out there, because there is. Remember our numbers, if you look nationwide we're breaking all the records, even at the peak of the pandemic. 2,000 people dying a day is not uncommon in our country. We're just seeing so many more cases that we really need to be vigilant. And I know I say that word all the time, but it is true. So 200,000 new cases a day is not uncommon, and these numbers are higher than they've ever been. So remember that last time it started off in the Northeast and kind of came down this direction, so we need to be very careful with what we're doing. There's a lot of things that I want to go over. Just a few things quickly, though. David mentioned the vaccines. Vaccines are what I've said since the beginning, what I consider to be the hope for our future with COVID. So Pfizer, of course, got emergency use authorization, and their offering of their product will be out. Supposedly being released on the 14th of this month, and will be coming to Victoria shortly thereafter. We're going to receive a certain amount of doses here, and we're going to start vaccinating those that are the highest risk. That will be elderly patients, of course, that we know statistically are not going to do well if they catch this disease, and we're also going to vaccinate our frontline healthcare workers. So my idea, and what I've talked about to people when we're doing these things, the state has given us guidelines, but we're pretty much we'll be able to figure this out. Patients that are workers or healthcare workers that deal with COVID patients on a regular basis are the ones that are going to need it first, because they're the ones that are most likely to catch the disease while at work. So we'll do that, and then hopefully within a couple of weeks after next week, we'll start to see a lot more vaccine come down. Basically what happened was the amount of vaccine being sent by Pfizer was cut back due to some kind of problem, and not with the vaccine itself, but actually with the distribution of it. So hopefully we'll get about twice that much or 3 to 4 times that much in a couple of weeks after the first shipment. So we'll have a lot more vaccine available. Remember that, and I'm asked this question 10 times a day in the clinic or in the hospital or wherever I'm at. People always ask me, hey, Dr. McNeill, are you going to get your vaccine? And I will tell you, absolutely. Absolutely. I believe in this vaccine. I believe it's safe. And I believe that statistically you're going to do better if you get vaccinated. Other questions like have come up, such as, what if I've already had the disease? Should I be vaccinated? The answer is yes. Because when you get the disease, you will develop some immunity to the disease. It's called conferring immunity. So you will confer some form of immunity. And actually some studies have shown that the sicker you are with COVID, probably the stronger your immunity is going to be. There's a thing called a dynamic range, and they say it's a massive dynamic range as to how much immunity people are going to develop after being exposed to the disease, either exposed to it with a vaccination or exposed to it naturally by catching the disease. So if you've already had the disease, if you've had COVID and you're offered a vaccine, then you should take it. And actually, the studies have shown that patients that have had the disease and get the vaccine are the ones that are going to be the most protected, okay, because the antibody levels are statistically higher. So keep that in mind. I think everybody should get the vaccine. Right now, the numbers are pretty clear. They've done a lot of polls, and approximately 40% of the nation says they're not going to be vaccinated. Well, that's got to change, okay? Because if we only vaccinate 60% of the population, we're not going to reach herd immunity. We're not going to reach it quick enough. We need 70 to 80% in herd immunity, and if we only vaccinate 60%, it's going to be tough. So I encourage everyone to get their vaccines. Now, as far as side effects, people have talked about what are the side effects, and we've had a lot of people that have been tested. I mean, a lot of the subjects that volunteered to get the vaccine. And you know what? It's not uncommon after you get a flu vaccine to feel kind of bad for a day or two, and they expect the same thing with the COVID vaccine. So we'll see how that goes. I'll let you know after I get mine. But for the most part, I do encourage people to do that. Some of the other things that we've talked about are, this is a good point. When to go to the hospital. When do you seek care when you have COVID? The majority of the people that I see that call me, or we do a test on them and we diagnose them with COVID, I tell them all the same thing. Take care of yourself, watch yourself. I tell them to take vitamin D and zinc because there's a lot of data that shows that might work, okay? There are a lot of other medications that we have available now. If you're sick, if you're confirmed with it, we have some new monoclonal antibody drugs that have shown good promise. But we can't help you if you don't come ask for help. So one of the things that we see in the hospital, in the emergency department, and being admitted and ending up in the ICUs are patients that literally wait too long to get help. I'm going to encourage all of you right here, and I'm going to tell you this, it's very important. If you start to get short of breath and you've been diagnosed with COVID, you don't need to be at home immediately. You need to be checked. You need to make sure that you don't have a significant pneumonia. And you need to watch a thing called your pulse oximetry, okay? Everybody's seen those little bitty deals that go in your fingers that measure the relative oxygen content of your blood. Everyone with COVID should have a pulse oximeter. And I'll say that again. Everyone diagnosed with COVID should have a pulse oximeter. And you need to watch your pulse oximetry because it will tell you about the oxygen levels in your blood. There is a phenomenon with this disease called silent hypoxia, and this occurs when patients basically become hypoxic. In other words, that's the medical term for low oxygen content in your blood. When your oxygen content falls, you don't do well. Most people become very short of breath when their pulse oximetry falls, when their oxygen content falls. COVID is unique in many fashions, but this is just one of the interesting, unfortunate things that it does. You can be very low on your blood oxygen levels and not have a symptom from it. We call it silent hypoxia. You can find out about this by watching your pulse oximetry, and that's why I say everybody that has COVID should watch their pulse oximetry. Now, you don't have to have one for everyone in the house, but if you have multiple family members, and this is not uncommon, there's a lot of patients that have multiple family members at home with COVID. Get a pulse oximeter and let everybody use it, okay? So watch your blood oxygen content. If it gets down to, normal is about 99, 97, 99, 100%. If it gets down to 94%, you start to worry. If it gets down to 92 to 90, you need to go to the hospital, because there are things that we can do for you and we can supplement you. And the worst thing that can happen is for people to wait too late. And that's what we're seeing every day. We're seeing these patients that are coming in and they've been sick at home and they've been getting sicker and sicker and sicker, and they don't get help soon enough and they end up in trouble. They end up on mechanical ventilation. Now, we're a lot better in treating these patients. I can tell you that the numbers have improved. The numbers of patients that are coming off of ventilators now is remarkable as compared to what it was several months ago. Several months ago, if you got put on a ventilator, you typically did not do well. That's not the case anymore. I'd like to think that we're getting better at treating the disease, and we are, because we have better medications, we have better things that we can do. But once again, we can't do it for you if you're just at home trying to make your symptoms go away on your own. So, take-home message there, make sure you get help early if you're diagnosed with the disease. Now, David talked about the Centers for Disease Control changing the standards of when people can be cleared from the disease. Remember that if you're tested positive, that after 7 days, if you have not tested positive, if you've been exposed to someone that's tested positive, before that meant an automatic quarantine of 14 days. Now we're saying that for 7 days, you can come back and get a test. If you're negative after 7 days, then you'll be cleared. So, and now they've changed the time. Instead of 14 days, you can clear yourself in 10 days. Okay. So, a lot of changes. These changes are all based on our evolving knowledge of the disease, and we'll keep doing that. I think those are the big points I wanted to talk to you about. There's a lot of stuff going around as far as, and the judge alluded to this, as far as virus fatigue, and people are just tired of this. I mean, people are tired of this. So mental health is an issue that certainly is entwined with this disease. I mean, it's hard to be home. It's hard to be quarantined, okay? But we have to keep looking at the future and knowing that the end is in sight. And I've always said, for the last 6 months, I've been saying the vaccine hopefully is going to be that end. And now we're looking down the barrel of that. It's very close. Good luck to everyone, and take care of yourselves, and any questions that I can answer.
Dr. McNeill, can we start just briefly? Can you address, you said 12 people right now are on mechanical ventilation. Can you explain what that, I understand that's not a very pleasant process. Can you explain that, and perhaps also just talk generally about what COVID does to the human body for people who are very ill?
Okay. Well, the question is asking about kind of the progression of the disease and what happens when a person becomes placed on a ventilator on mechanical ventilation. That's something that we do, and basically we don't put a person on mechanical ventilation until they're basically unable to oxygenate themselves, or they're unable to get enough oxygen in their blood, or they're not able to blow off enough carbon dioxide. And we watch those parameters very closely. We try not to intubate people or try not to put a tube into their throat unless we absolutely have to. So when it comes to that point, the patients are sedated. Nobody should be awake with a tube in their throat. So we sedate them heavily. We give you medicine and you nod off and fall to sleep. We place a tube in the lungs and we put you on mechanical ventilation, and we basically breathe for you and adjust from all the different parameters, including all the blood tests that we do and all the oxygen testing that we do, and we adjust that ventilator to the patient's needs until we can get them to a point to where they're able to breathe on their own. Then we lighten up the ventilation, we lighten up the sedation, we wake them up, and hopefully we pull the tube out and they breathe on their own. So that's the process. I know I simplified the process, but there are some people that have been on ventilation, mechanical ventilation, for weeks and even months. So we try not to do that, because once they're intubated and once they're on a ventilator, they are critically ill.
And this is a question that can be answered by, I think, any of the four of you, but Judge Zeller, you mentioned at the beginning that the local approach has been to provide information and guidance, and my question is, have you provided enough? I mean, most experts think that we still have not hit a peak in terms of COVID hospitalizations and deaths in the country. It might get worse than it was in the summer, and do you think the community really understands what's at risk here, given the fact that we are headed in the wrong direction?
Let me just talk about the medical part, and then the judge can tell us about that. But I can tell you that honestly, and I'm going to tell you this, I mean, these numbers are going up again, and we're getting right now into the post-Thanksgiving peak. Remember, I say this every time. People get sick in the first 3 to 5 days. They get really sick from 7 to 14, and they either get well or they get in the hospital. Several days after that, they get into the ICU if the disease progresses. So we're at that point right now to where patients are being hospitalized, and I can tell you that in the last 24 hours, has been some of the busiest in hospitalization that we've seen in the last few months. So these numbers, and it's unfortunate, but it's very predictable. And I'm telling you that these numbers are going to increase. Nationwide, the number of deaths is higher than it's ever been. We were shocked when we were hitting 1,000 a day. Now we're hitting 2,000 a day. So 200,000 plus new cases every day. So we're seeing a lot more disease, and we expect it to increase. Thanksgiving was a spike superimposed upon another spike. Christmas is going to be a spike superimposed upon the previous two spikes. So we have to be very vigilant, we have to be very careful, and I don't think I've said wear your mask and wash your hands and stay away from people yet, but that is what we do. Judge?
Sure. I'll speak to that briefly, and it's a great question. Are we doing enough? Are we providing enough information? As far as the providing information goes, I really don't know what additionally we could do that we're not doing. We did identify one thing, and that's the 15% threshold that we'll now include on our daily reports. But throughout this whole process on a daily basis, we've given the daily case counts and all the data that we have. Of special note is our hospital capacity, and it's one of the things that led to today's press briefing. That is, in my mind, probably the most important threshold, the most important metric that we need to look at. Because it's not just COVID patients we're talking about. When hospital capacity is reduced, that's the availability of a bed for anybody for any reason. Car wrecks, falling off the ladder, anything that reduces that hospital capacity is of concern. And like I say, there's an expectation, whether it's COVID related or related to anything else, that when people get sick, there will be a bed immediately available. And if they're very sick, there'll be an ICU bed immediately available. There's jurisdictions throughout the state and the country where that has not been the case. And really, when you see the worst outcomes is when the hospital apparatus gets overwhelmed and you have medical workers that become patients themselves. That's the danger zone. And I thought that was important to communicate today via this press briefing, because while there may be cynicism about, the severity of the disease, the fact that many people who have it have no symptoms, there's no explaining away hospital numbers. The folks that are in the hospital, there's no refuting the impact of that, which is why I think that really is one of the best metrics that we have. Daily numbers can be a function of the number of people being tested, the availability of tests, but really to show the severity in a region is the hospital number. So that's why we're going to be providing that one threshold going forward in our daily numbers. Beyond that, I think we are doing what we should, and certainly the feedback we get from the community in terms of why aren't you providing this, what about this, we take that to heart, and we've adapted the information that we give out on a daily basis based on that. But I think that the approach we're taking does provide the right information, and certainly now with the governor's executive order disallowing, for the most part, local decision making, I think we are doing all that we can, but the information is important. The hospital capacity is extremely important, and that's something that I look at. And that was a priority back during the early summer, during the summer when we were talking about this. That's really a threshold that no cynic can disregard, because a full hospital with little availability means that any non-COVID illness or emergency would be impacted. So I hope that answers your question. Any follow-up to that or any questions from anyone else?
Valerie Perez, News Center 25. So as the numbers, if they continue to increase, despite the fact that we're social distancing, wearing masks, washing our hands, will you potentially start to give warnings or citations, or maybe even think about starting to do a city curfew or a lockdown if the numbers don't start to go down? After a certain time frame, of course not.
As it sits now, what would normally be a local decision like that, whether it pertains to a curfew or any other measures, those abilities normally present in a situation like this have been taken away by the governor. So unless and until we're given that prerogative again, those are not options that we have. But I think in conveying the information, people do understand the severity of it and where it could lead. Largely, I think folks have accepted masks as the normal for now. It's inconvenient to everybody, obviously, but it's a small step that can be taken that goes a long way. And again, a lot of what we would normally have in terms of prerogative to make these decisions, the mayor and I no longer have due to the governor's decision.
Okay, and then as Mayor Rawley McCoy mentioned that the elderly and first responders will receive the vaccine first, do you all have an idea right now of maybe another group afterwards that you're potentially thinking of receiving the vaccine? For example, teachers, grocery store workers, anything like that?
David or Dr. McNeill?
Sure. So the state vaccine allocation panel has lined up a series of priorities as far as groups who are going to get the vaccine. So right now, the first 1A of the first tier is going to be the healthcare workers, EMS providers, as well as the nursing home residents. But they've subsequently lined up tier 1B, and then other tiers as the vaccine becomes more available. So those are all in place. It's determined by CDC and DSHS. It's not a local decision, but we'll have all that, and we'll be happy to provide that via our Facebook page, and also you can reference CDC and DSHS for that. Specifically, the question about school nurses, I can refer down to a document I have down here to see. They will be, let's see, physicians, nurses, community pharmacy staff. These are all second tier. And then school nurses will be in the second tier. So they're in the next tier after this first allocation. Yeah.
I think this can be addressed by any of you, but just briefly, I did want to ask, can you walk us through what agencies are responsible for enforcing orders on capacity of masks? Are they being enforced locally, and should we be enforcing them more aggressively, given that we've primarily had an approach that's education-based to now, and that doesn't necessarily seem to be working?
Let's take that.
Well, one of the problems in enforcement, quite frankly, is the way that the order was written about detention. Some law enforcement people will say that they cannot issue a citation unless you can detain someone. So that's one of the problems we have with the governor's order. I think that, but as we've done from the very beginning, I think to ask people to do the right thing has worked here. I think as the judge says, you see more and more people wearing masks now. The thing that kind of disturbs me personally is when I read things on Facebook about people getting very belligerent with someone working in a store and something like that, taking their frustration out on somebody who is simply doing their job. I find to be quite distasteful. Number one, that person has no power over the fact that they're doing their job. And what most people forget, when you go into a private business, that business has every right to require you to wear a mask that is equal to what you perceive as your right not to wear one. And so you need to respect that business's right to ask you to wear a mask to protect their employees. And I think that's something that we all need to work on and respect about the situation in wearing masks. Now, I want to revert back to a little bit about numbers. I can tell you that probably for the last many, many months, since about midsummer, when I receive the numbers from the health department on a nightly basis, as does the judge and everybody else that needs to know, I send those numbers to both our state representative, Jeannie Morrison, and our Senator Lois Colthurst. Why do I do that? Because they're the ones that handle these situations at the next level. Senator Colthurst chairs the Health and Human Services Committee of the Senate. Jeannie Morrison has a lot of connections in the departments of health that issue supplies to us, especially when it came to supplies early on in this. And they have both been extraordinarily helpful in getting the things for us that we need in Victoria. And they appreciate those numbers, and I'd send them 7 days a week. And most of the times when I send those numbers, I get questions back. What about this? What about that? So as far as us keeping up with the numbers, I live with those numbers every single day, and most of the people standing here do so. And that is why we're here today, is to talk about the numbers and where we're about to go or where we might go. And so you will see our reaction will be predicated on what the numbers do in the next several weeks. But as we've always done, when we think it's appropriate, the judge and I have this discussion quite often, and when we think it's appropriate and it can add information to people and provide them with the information they need to combat this situation, we will be at this podium. And so that's what our job is to do, and that's what we will do moving forward. Are there any other questions?
I think this one can either be answered by the doctor or you, Mayor. Even when the vaccine is given to the first tier, second tier, et cetera, will you continue to tell the public to wear their mask and social distance? That, for example, once you have the vaccine, you shouldn't just anticipate to just go on our normal lives like we did before?
Well, I think that the answer to your question will evolve, but I'll let Dr. McNeill or David speak to the actual medical part of that.
Well, there's a simple answer to that. Who knows? So we anticipate that people will confer pretty good immunity after this thing, but the recommendation will still be for masks afterwards. So remember that we're talking about a reservoir. You know, we're not even sure exactly how long it's going to take. You take your flu vaccine, it takes 2 weeks to get enough immunity to fight the disease off. So we know there will be that period, and during that period, you'll certainly have to have a mask on. I don't think that it's time to go just wild and crazy after you get your vaccine because you can do what you want. We still have to think about others.
And then this final question is just about testing. Are there any known reasons for test results and the delays that we've been getting for COVID-19 in some of the clinics?
Well, it all depends. I mean, the clinics actually don't have anything to do with it. It's whoever they're sending it to. And if that clinic is part of a lab that there are 100,000 tests going a day, then it's going to take a little bit longer. So we use a variety of different clinics, and I can tell you that I kind of go back and forth, and I'm like a smart shopper. I find the best deal on them, and I look for who's getting the, by that I mean whoever can get them back the quickest. And we've been very fortunate in Victoria. We have clinics here, you know, the Next Care clinics have, a lot of times they have overnight, I mean they have immediate testing, so you can get those rapids. We have your health lab that we use very frequently that gets the results back usually the next day. CPL does a real good job, and we're still at 1 or 2 days on them. So overall, there were times when we had to wait 7 days for testing. I mean, I know people that got their test results 14 days after they tested. So, I mean, they were quarantined the whole time anyway. So it's a lot better than it was, and there's a lot more testing available than there was before.
And just quickly, one more question on testing. 18% of Texans don't have health insurance. That number might have increased because of pandemic-related job losses. If you don't have health insurance in Victoria, is there a way to get a free test?
As far as a free test, David, do you know of a way?
I do not.
I do not.
This time. I've heard discussions of possible free tests, but I don't have direct information.
Yeah. Now we did bring that, you know, the military option in once or twice, and but other than that, I have not known of any free ones. The cheapest I've seen in town, I think, is a little over $100.
Okay. Seems a bit unaffordable if you don't have health insurance and might have lost your job.
Well, it's pretty much just like everything else in healthcare. I mean, that's just a problem. So.
All right. Yeah.
Okay. All right. Judge, you want to?
Oh, sure. We appreciate everybody's time today and for the excellent questions. For those who have tuned in, we thank you for your time and attention. As long as COVID-19 is an issue affecting our community, you can count on us to continue taking it seriously and doing what we can to limit its impact on the community. So as we enter the holiday season, if we don't see you before then, want to wish everybody a Merry Christmas and Happy Holidays, and you'll hear from us as needed. Thank you all.